we kind of take for granted all the medical facilities that are here available to us throughout the Metro Detroit area. I grew up in a very small town, and we had a very small town hospital. And when you really need the expertise, we always have someone here, and that includes Dr. Charles Day. He's an orthopedic hand surgeon over at Henry Ford Health Systems, and he is joined with us today along with one of his patients, Keisha Triplett. But Keisha, before we get to you, Dr. Day, thank you for being with us. I really want to touch on this groundbreaking surgery that you performed on Keisha, which was a total wrist replacement. Can you tell us more about that?
Sure. Well, thanks for inviting me. I appreciate the opportunity. Total wrist replacement is a procedure where for my patients with the worst arthritis of the wrist, we can replace the joint by giving the patient a new metallic joint that allows the patient to move and be relatively pain-free.
That is amazing. So not many of these surgeries have been performed in the U.S., and you did one recently, and you did it on Keisha. How did it go?
Well, I'll let Keisha do the talking.
Hi, Keisha. How are you? Welcome to the show. Thank you for being with us.
Thank you for having me. I appreciate it.
So tell me about your limitations prior to the surgery.
Oh, I couldn't do anything with my left hand, like holding things, opening up things. I couldn't even vacuum a floor. Anything with this left hand.
How long had that been going on?
Oh, for over about 20-some years.
Oh my gosh.
Wow.
Yeah. Yeah, I dealt with this for quite some time. It was painful.
So this past, was it May that you had the surgery, and how are things going?
Yes, May the 5th, and now today I am completely healed. I'm done with therapy. I have no pain.
And you can use your wrist like nothing.
Yes, I can use my wrist. I can move it up and down. I'm using my phone with the hand that I had surgery.
Oh.
So, which is a good thing because I couldn't do that before.
Wow, really those little things that so many of us take for granted, but has been life-changing for you.
Exactly, yes.
Oh my gosh, we're so happy for you.
Yeah.
And really to be through therapy and just a few short weeks after your surgery. And so, Dr. Day, if I can bring you back into the conversation, can you tell us more about the surgery? What does it entail?
Absolutely. I think that it's love to hear these stories from my patients and to know that what I do makes that much of a difference in their lives. But the reason why total wrist replacement hasn't taken off the way maybe a knee replacement has. I mean, no one talks about knee replacements happen all the time. It's been going on for decades. But total wrist replacement has only been happening over the last 15 years or so. And it's because there are 15 bones in the wrist. There are only 3 bones in the knee. And to get a total wrist replacement done well, you have to align 15 bones correctly versus you only have to align 3 bones correctly in the knee. And so that adds to the complexity of what needs to happen. And on top of that, it's just a new endeavor because only about 20 years ago did they start designing a wrist replacement specifically for the wrist.
But Dr. Day, I'm thinking about this, and I think about how much we use our hands, especially in modern day with technology. You need it to type, you need it to write, you need it to really function in the world. So do you anticipate you're going to see more of this in the future?
Absolutely. And I don't want to say that the total wrist replacement is for everybody. I think that it's for the right person. Somebody like Keisha is the perfect person for this. She's been living with pain in her wrist for 20 years.
That's insane. Oh my gosh.
That any little thing she does, holding a carton of milk, holding a pot, holding a pan, that's bothered her. She couldn't even carry her grandchild.
Yeah.
So to be able to bring that back for her, and that's just amazing, and I'm just so grateful to be a part of that.
So, Keisha, if I can ask you, how long was the surgery?
4 hours, I believe.
That's about right.
And so with that, were you a little bit nervous going in?
For me?
Yeah. Prior to the surgery, were you a little bit nervous, or were you just like, I need some relief? I don't care what it is.
Yes, that was the main part. Me wanted to just get some relief from this wrist. So I was a little nervous, but after, me talking to the nurses and they was calming my nerves, and I was okay with everything.
When did you start having the conversation about thinking about a wrist replacement? I mean, the words themselves are daunting.
Oh, this was way before the pandemic had even started. I had talked to Dr. Day.
Oh, and so, but you still ended up doing it. I mean, we're emerging from the pandemic, but there's still the concerns of COVID-19.
Oh, yeah, of course. But no, I was okay with it.
Keisha Triplett with us here on the MegaCast. She is a patient of Dr. Charles Day over at the Henry Ford Health System, and she had a full wrist replacement. She was the first total wrist replacement surgery done at Henry Ford. Were you a little nervous being the first person?
I didn't quite know until after the fact.
Oh, you were just like, I want relief.
Yeah, but then when I was going to therapy, they was like, there goes the star. I'm like, oh, me?
So, to be fair, I think when I talked to Keisha, this is the number 12 total wrist that I've done. But the other ones were done in Boston. So
okay.
I moved to for health years ago. And so this is the first one I've done here. Now, since I've done this, since I've been on these talks, somebody had said that somebody might have had done this procedure like 10 years ago, but I'm not sure if that person's still with the system anymore.
Well, we will say that we're okay with you doing the surgery on some guinea pigs in Boston. We're okay with that, right, Keisha?
Yes, we are. Yeah.
What does it take for you, Dr. Day, to prepare for a surgery such as this?
Well, I think that you have to have it's important to have some joint replacement background, so that, I think most orthopedic surgeons coming from an orthopedic surgery background, we're familiar with joint replacements as a whole. But then to be able to do this for the wrist, you really need intricate understanding of the anatomy around the hand and wrist, and being able to understand how these different bones interact with each other, so that you can put together the right components in the right way.
But how do you figure out if a patient is a right candidate for a surgery such as this?
That's a great question. A lot of patients get wrist arthritis, but not every wrist arthritic patient can be or should be a good candidate for a total wrist replacement. And it's usually for people with diseases like what Keisha has, which is a rheumatoid arthritis. She has rheumatoid arthritis, which is a long-standing chronic problem that she's had for years in her wrist. And for patients like her, who's not like she's not a laborer, she's not working a construction site, or she's not a farmer, for instance. And those professions would be less amenable to a total wrist replacement.
So if I can ask you, how does a patient know when they should ask maybe they need this? Or is it really one of the situations such as Keisha where it was really impacting her day-to-day life?
Yeah, absolutely. I think that the most important thing I would recommend for patients is if you're having pain that's unrelenting in your hands and wrist, get it checked out. Get it checked out by an experienced hand surgeon, so that they can talk to you about, number one, what's causing it, and number two, what are the different options to make it better.
So if I can ask you, what does typically cause complications such as this in a wrist?
So a lot of times, if it's not rheumatoid arthritis based, then a lot of times it's what we call post-traumatic arthritis, or a patient may have a chronic injury of the ligaments. So a sports medicine injury, a fall that a patient had many, many years ago that had a bone that had a broken bone that may have healed incorrectly. All of these conditions can create long-term chronic pain for our patients. And there are a lot of different solutions that we have in the hand and wrist world to take care of these problems.
So, Keisha, if I can ask you, you've lived with this for 20 years. What made you even spark this conversation to know that the surgery was possible?
Because I was having like swelling in my rib, and it was ongoing pain. So I was like, something has to give. I need to talk to someone about what is going on with my rib. So that's when I talked to Dr. Day.
Can I ask you, what has the journey been like from you, though, from the beginning, understanding that you had problems to getting to the point where you couldn't even use your wrist, to getting to a surgery where you get a full replacement?
What was the journey?
Yeah.
Wow.
When did it start? And because for so many of us, we live with kind of these ailments, thinking we can manage them. Was that what you were thinking?
Yes, for so long I thought that I could live with just, okay, there's pain. Let's do something let's just not use the hand. Let's soak the hand. Let's do whatever we can. Before I came across, I need something else has to be done.
So I know that you're driving a little bit, so we're losing your signal. But how did you find out about Dr. Day?
Before I researched him, and I thought he was a good doctor for him, just to see what was going on with my hand.
Because were you trying to find some type of solution? It didn't matter what it was. You just wanted relief.
Yes. Even if I had to get steroids, if I was much today, so I was getting steroids in the hand. So now I'm along where something else is wrong with his wrist. When I take the Dr. Day.
Well, we're so happy to know that you're doing better, and what a change in life that you're going to experience going forward. Just about a few seconds left here with you, Dr. Day. Can I just ask, if people are having symptoms, when should they know to seek out services such as yours?
I think that if you have symptoms in your hand and wrist, I think one of the first things you can do on your own, especially if it's after an injury, is to purchase one of these braces from a wrist brace or a hand brace from CVS. I mean, there's a lot of these braces that are commercially available. By immobilizing yourself for 3 to 4 weeks or so, it should get significantly better. If it does not, it may speak of a more concerning problem, and that's when you really want to see a specialist about it.
Well, we so appreciate the time of both of you here today, and I can say that while she is the first, I'm sure she's not going to be the last to have the full wrist replacement, and you have made such a difference in her life. So thank you to the both of you for being with us today on the MegaCast. We appreciate it.
Thank you.
Thank you for inviting us. Bye-bye.